All right, we are at T-minus 1 day before surgery. Set up tomorrow for AC joint kind of hold up or replacement. They're going to use a tendon to effectively prop up my shoulder. So basically, setting the table, July 29th, had a bike crash in Boulder, Colorado. Had a basic olecranon, which is the tip of your elbow. Had a compound exposed fracture. My understanding was pretty minimal. It's not like my bone was all over the place, but they did have to do emergency surgery that day. So been 2.5 months since that actually happened. Over the course of time, came back to Chicago, help from family, gone through a lot of physical therapy, a lot of rehab to get the elbow basically to where it is now. Effectively, we're at about 0 on the flexion with a little bit of pain to get to that point. The shoulder touch, if you will, is about 143, 144. So basically getting there, have full confidence that will recover for all intents and purposes. So anyways, coming up for this surgery tomorrow, what I plan to do is just walk through kind of how I'm feeling on a daily or periodic basis as I recover. Hopefully it's going to be useful information for anyone going through this kind of injury as well. So again, as I mentioned, the AC joint will be replaced tomorrow by Dr. Mara here in Chicago. Basically, my prep and understanding is no food after give or take midnight, no water after 6 a.m., show up at Northwestern by about 8:30, 8:45, kind of get ready for surgery. Should be outpatient, should be released later on that afternoon, early evening. My dad will be driving me. And effectively, when it's all over, just, going to start the recovery process again. Had a clavicle non-union surgery back in 2015, so it's been a little while, but kind of know what I'm up against. I don't know if that's a good or a bad thing, but here it goes. So every day when I kind of post these, I want to basically ask or answer 4 questions in terms of how I'm feeling, how things are looking, and really just go from there. So how am I feeling physically? Well, obviously today I'm feeling just fine. It is the day before surgery. My elbow is in pretty good shape. Actually been able to put a little bit of weight through it. Not supposed to be doing that, but such it is. So haven't had a chance to do my physical therapy exercises today simply because I'm going to be having to do a lot of errands, getting a lot of things done for all intents and purposes before the big day tomorrow. How do I feel emotionally? I guess I'm confident that this will go well. I have every intention, and I trust the doctors, and there's not like anything I can do about it anyway. So can enjoy the journey, enjoy the ride, try not to look at the needles as they go in, basically call it a day from there. I think that's the main goal of what am I doing. Really just trying mentally to be ready for tomorrow, and just, there's nothing I can do. So at the end of the day, it's a journey, it's a car, it's life. I'm on a rock flying through space at 200,000 miles an hour or whatever. My life is good. So what are my kind of doing today thoughts on the injury and recovery? So one of the things I'm going to try to answer every day is just what am I physically doing? Well, today, because it's the day before surgery, nothing really I have to do. I probably should be doing more shoulder shrugs and shoulder backs and things like that, but nothing necessarily going on there because I've been a little bit lazy. And finally, I want to round out all these videos every day with something I'm thankful for. And the reason I'm going to do this, simply just because maybe if I'm having a bad day or things aren't going very well, just want to have something that kind of keeps me grounded, keeps me level set with everything. I'm going to start off first and foremost, family, everyone have been around here to help me, especially my sister, my parents, my nephews. They've just been rocks for the last couple of years, helping me throughout everything. This injury is just adding on top of the pile. There's a debt to them I can never possibly repay, and I keep digging it further every single day, I feel like. So at the end of the day, that's basically where I'm at. So at this point, that's it for today. Effectively what's going to happen, we'll go in tomorrow for surgery, get started from there, and then after that, kind of see what I'm up against. So into the wide unknown. Until next time.